Hello, I'm Dr. Gaurika Aggarwal and today we'll be discussing about fibroid uterus. As we all know that fibroid uterus is a very common problem faced by many women during their lifetime. Approximately 80% of women throughout their life at one stage or the other have this problem of dealing with fibroids. So what are fibroids? Fibroids are basically abnormal growth of the uterine musculature resulting in a mass or a lump in the abdomen. Fibroids are usually benign conditions, but in a few percentage, less than 1%, they can have a malignant potential. So essentially we'll consider them as benign tumors of the uterus. Now they can be asymptomatic. In majority of the patients they are asymptomatic, but in a few patients it can have symptoms. Now what are the symptoms? Now symptoms depend upon two important factors. One is the location of the fibroid and the other is the size of the fibroid. So going by the location, if the fibroid is growing inside the cavity of the uterus or the endometrial cavity of the uterus, it can result in heavy menstrual bleeding, irregular menstrual bleeding, as well as excessive vaginal discharge. In case it is not, it is not growing inside, but it's growing outside the uterus. It's growing from the uterus outside towards the rectum and the bladder. Then it can cause pressure symptoms and it can cause pain. Now, if the size of the uterus of the fibroid is very small, then they are usually asymptomatic. But if they are large fibroids, size is more than 5 centimeters, so they become symptomatic. Symptoms can be again heavy menstrual bleeding, excessive bleeding, and obviously discharge and pain. They are associated with infertility also in a large number of patients, and they cause inability to conceive, especially when the fibroids are more than 5 centimeters, either growing inside the cavity or when they are inside the uterine musculature as well. And they can also cause frequent miscarriages in women who have large fibroids, who are conceiving again and again, but then the baby usually aborts in the mid-trimester. Now we know about all the symptoms of fibroids. Now how to diagnose them? Once we have these kind of symptoms, we should definitely consult our healthcare provider or a gynecologist, and she will guide us how to go about the diagnosis. So diagnosis is not very difficult, it's quite simple. It's an OBD procedure where a grayscale ultrasound would be good enough. A transvaginal scanning, a 3D ultrasound also is rarely required. And in a very few cases, we might require an MRI to diagnose a fibroid. Now after the diagnosis, once the diagnosis is made, coming on to the treatment. Now is the treatment available for these fibroids? Yes, of course. Many treatment in the form of medical management and surgical management is available for fibroid uterus, and we should never be disheartened. So in case we have a report mentioning a very small fibroid with the patient having no symptoms, we should definitely allay the anxiety of the patient that a less than 2 centimeter fibroid with no symptoms usually does no harm to the patient, and the patient should relax and just do serial monitoring with an ultrasound maybe yearly, and then should not worry more about it. But in women with symptomatic fibroids, we can offer her medical management or surgical management depending on her requirements. So in case of medical management, we have a number of drugs, like for example the hormone birth control pills, which can help in reducing the amount of blood flow, which can also help in regularizing your cycles. And then we have intrauterine devices, like for example the Mirena, which releases progesterone to regularize your cycle, basically decrease your bleeding. And we can also have injections which can be given monthly in the form of GnRH agonists, and a newer drug like progesterone receptor modulator to decrease or shrink the size of the uterus. Healthcare provider, by looking into your symptoms and your requirements, and it's not that we should not be very optimistic about it that it will decrease the fibroid size or the fibroid will vanish once we start taking medical management. We should understand the fact that this medical management will only help in decreasing the blood flow or in decreasing the symptomatology of the fibroids, does not really act on the fibroid itself, the size of the fibroid. So the fibroids won't vanish after the treatment. So one should be very clear of that. Now in case women are not responding to medical management, then of course we have surgical management available for those women. Now in surgical management, there are three categories of women who definitely require surgery to alleviate the symptoms and to make them symptom free. So one is a woman who is having a large fibroid, who is having abnormal uterine bleeding and who is not responding to medical management. She is a candidate for surgical management. The other is a woman with a large fibroid who is having a lot of pressure symptoms and who's having a lot of pain. So she's again a candidate for surgery, because no amount of medicines will relieve your pressure symptoms or pain symptoms. The third category is women with infertility. The fibroids with infertility definitely requires removal of the fibroid. Only then the infertility part will be treated. Right, so in these three categories of women, we definitely have to go for surgery. Now, what are the surgeries available and what is the route of surgery? So, if we understand the route of surgery, there are two routes of surgeries, and one is the abdominal surgery and the other is the laparoscopic route, and of course the robotic, which is now coming up. But predominantly two major routes, laparoscopic as well as abdominal, and the standard or the gold standard is definitely, I would say, is laparoscopic surgery because of its known advantages, and women usually are opting for laparoscopic surgeries now because it has a lot of advantages over the open or abdominal method. Now, what are the two surgeries which can be performed laparoscopically? One is the myomectomy, in which we just enucleate the myoma along with its capsule and then suture the myoma bed. And the other is basically the complete removal, that is of the uterus through small incisions made on the abdomen and the vagina. So this is the other two methods of treatment. So in women with infertility or who want childbearing, who want to have a child, in those women we preserve the uterus and we just remove the myoma and suture the uterine bed and then ask the women to get pregnant 2 months, 3 months later post surgery. Another mode of surgery that we can offer to women who have fibroids in the cavity and are showing symptoms of infertility is hysteroscopy. In hysteroscopy, basically what we go with an endoscope inside the uterine cavity, look at the fibroids and remove them. And then the patient's cavity is fit enough to hold a baby. So this modality is definitely has very good results in patients with infertility. Now, in women who had underwent treatment for fibroids and who underwent a myomectomy, these women will have a small chance of a recurrence of these tumors, and that has to be explained to the patient once the patient is counseled for myomectomy, that the chances of recurrence are there. Okay, so patients should understand that this is a abnormal growth of the uterine muscle, and once we remove that growth, again it can recur in the coming years. Now we have another modality, which is basically laparoscopically ligating the uterine artery at its origin so that these tumors don't recur. So these can be done in women who have completed childbearing and who have undergone a myomectomy and don't want a recurrence of their tumor. In those women, what we do, basically we go in laparoscopically and we tie the blood supply of the fibroid and at its origin, and therefore once the blood supply is gone, then of course the myomas usually don't recur. So this has come up with a lot of success now. So this is giving an overview to patients of what are fibroids and how can we manage them. And we should not, once we have symptoms, we should not sit at home, we should not ignore them because the size continues to increase. And sometimes they become very, very large and they have to be dealt, abdominally. They can't be dealt laparoscopically. So therefore we should save time, we should visit our gynecologist and definitely seek help. Thank you so much.